got a call. That head is over shoulders, shoulders over hips, hips over ankles. So we're looking for clearance, and the right arrow held down, I can spin this, focus on the detector, and our biggest focus is right here. Do I have distance? And typically for every CT scan, I'm just going to evaluate I have distance. If I don't have distance, if that sensor and detector, this detector is too close to the patient's head, not getting clearance, if I lower the unit, I'm going to lower the unit. You see his head go forward? It's wonderful. So I have plenty of clearance on this patient, so I'm not worried about it. So the right arrow is all about this detector. Do I have clearance here? If I don't have clearance here, then I'm going to take my patient and move his hands on the inside and crisscross one wrist over the other, and maybe even slide their hands all the way up. And that gives me so much clearance. If I don't get clearance there, I may say, patient, can you take a step forward? And I'm going to get a lot of clearance. So these are the points of interest here, behind the protuberance of the head and across the shoulders. But we have clearance. So the next thing, when I know I've got clearance, I like this patient's head positioning, I'm going to hold that left arrow down. And the left arrow, my focus switches to the light coming out of the generator, which is known as the canine light in Panorex mode. I am holding this left arrow down. I'm watching this light. All I want to see is that this light hits anywhere on number 8. And you see how he's doing such a great job of showing me his teeth. If I'm confused of the vertical lights, I can cover up the mid-sagittal, which is coming out of the mirror, cover that up, and assess this light better. And I've held the left arrow down until it stops. And all I want to see is that light comes anywhere around number 8, and I'm happy, and it's coming far beyond that. What can happen is your patient will come forward. They'll come out of the notch. So you slide forward, and then that light is shining on number 7 or number 6, depending on how far forward they've come. See how now when he scoots back into the notch, then he's in place. So you do want to double check, especially if you're working on anterior teeth, that this light shines anywhere on number 8. If it's shining on number 7, number 6, number 5, then that means the front teeth will be cut out and you have to scoot your patient back. If it's not working for this bite stick, if your patient needs to go further back, then I want you to trade it out. You take that bite stick out, and we'll put that middle prong in, and we bring the patient back. And sometimes, these are for your difficult patients, sometimes I'm scooting them back. They're not against the chin, the ridge. Ideally, you want them against the ridge. But in this pre-positioning mode, you want that light to shine on number 8. If it's not, slide them back. The other thing too, if you use this chin rest here, you want to use a cotton roll because he doesn't have the bite stick to bite on. So we need to grab a cotton roll, place it where there are teeth, where he has teeth to bite on, occluding with each other to separate the arches. You always want to grab 1 or 2 cotton rolls. So this, to finish up this pre-scan, now that I like that, we need to hit the reset. It's critical. We'll hit reset. And from there, the machine resets itself, repositions itself, and then we can actually go into positioning the mid-sagittal light. And that mid-sagittal light between his face, you know, we're looking at between the eyebrows, right under the nose, we get that. We lock and load, tighten. We've done the pre-scan, we've done the positioning, and from this point we can hit ready on the touch screen or the remote control. Stay with the patient until that light is green, and we'll go fire. So I can see the computer letting me know that I have hit the ready button, and that light will be green momentarily, and we can fire our image. That covers your CT patient positioning, including the pre-scan of the right arrow, left arrow, and reset.